Okay, hello everyone. Hello dears. So yes, can you hear me? Is the screen clear so that we can start the session now? All of you? So yes, Sri Rangraj has joined and Mr. Verma has joined. So just let me know, is the screen clear and so that we can start the session now? Okay. So yes, today's session is of parasympathetic ganglion of head and neck region. Okay, so before starting the session, I would like to give you the brief information about the Unacademy platform. So the first thing is that you can use the code NAT10 as an unlock code if you want to see free sessions on the Unacademy platform. Okay, so on 15th of September, I am taking two sessions. One will be recall questions of NEET PG 2021. This will be a 6 p.m. session, and other will be the joints, general anatomy joints topic, very important, at 7 p.m. So two special classes are there at 6 and the 7 p.m. So do join for these session. It will be highly helpful for you if you are targeting your important topics to be covered up. So do join my free session, and what I want you all, that the students who are watching the session for the first time, okay, so yeah, the students who are watching the session for the first time, they should download the Unacademy app and thereafter find it their goal as NEET PG, and thereafter use the code, unlock code and add 10, and then they can see the free sessions on the Unacademy platform. So do join 15th September evening session 6 p.m. and the 7 p.m. If you want to just to know about the MCQs being asked for the NEET PG 2021 recall MCQs, you can join me for the 6 p.m. session. And if you want to understand or read the concepts behind all the important types of joints in our body, you can join me 7 p.m. session. So what are the features of 7 p.m. session? Let me tell you. If I talk about the 7 p.m. session, the important features are that attend live classes, participate in the live chat with the top educators, and you can ask your doubts right itself and get cleared. Now polls are conducted, that means polls are conducted when the session is being taken. So in that category, what will happen, you can know what is the weak area and which of the topic you want to make it better, and more of revision is required. Raise your hand while the live session is going on and interact verbally with the top educators, and never miss a session. So what happens, for example, if you want seeing my session, free special session on the Unacademy platform, what you can do, you can you will get a notification regarding all my free sessions and plus courses, so you will be notified. So it is not possible for you to leave the session, means a reminder is already given to you. So that is a best point. Other important point is, after completion of the sessions on the special class of Unacademy, which is absolutely free, you can also download the Unacademy app. Yeah, sure Verma ji. Okay, yeah, I will use Hindi also, don't worry. So lecture notes can be taken by you anytime, anywhere. So the other important point is that आप अपने place में पढ़ सकते हैं, and you can study there at your own place with your own device at your own time. Use the code NAT10 to unlock to be the part of free session. So what I am explaining here is that you can be the part of free session by using the code NAT10. Okay, now let me tell you about the plus subscription benefits. So when we are talking about the plus subscription benefits, you can assess. So आप free sessions and the plus platform के sessions, all 19 subjects. So there are 19 subjects for targeting the examination. So all that sessions taken by the top educators of Unacademy platform can be assessed by you. So learn from India's top educators in the medical field, compete with live tests and quizzes, and you will be able to crack the exam. Coming soon, it's not coming soon, it's have already been there. So you can also have the session of Iconic and Plus, and you will get the printed notes provided. More than 25,000 MCQs are there on the platform of Unacademy, which is based on the latest panel. Okay, sure. So okay, so in between, yes, some of the students are telling continue in English, some are telling Hindi. So don't worry Verma ji, when in between, if you want to know, understand anything which requires in use of Hindi, I will use it. So assess more than 25,000 MCQs based on the latest pattern which is included in the entrance exam, along with a detailed description of video recorded sessions will be there. Study on the device of your choice, and it will be easy for you to understand at your own place, and you can interact with the top educators. Every fourth session on the Plus platform is a doubt clearing session. It's a doubt clearing session. So that all are benefits of the Plus subscription. So go for it and definitely use the code NAT10 to get 10% discount. Now let me tell you about the benefits of Iconic subscription. So here you get the benefits of two platforms. One is the Plus and the other is Iconic. So here all the benefits of Plus platform is added on with the Prep Ladder platform benefits, that is clinical integrated versions will be available to you, video lectures from the dream team of the Prep Ladder, QBank 3 can be assessed by you, rapid revision snapshots and treasure sorts 2021 dream notes will be provided to you. All these can be available to you by using the code NAT10, and you can get additional 10% discount. So my dear students, here is a good news for you. So let me just enhance this diagram. So can you see here, limited time offer is there. So my dear students, if you are anyone, so if Sri Rangaraj, Mr. Verma or anyone who is listening the session is planning to take the Plus subscription of Unacademy, definitely you should go for NEET PG Iconic subscription, where the merging of both the Prep Ladder and the Unacademy has been done. That means you get the benefits of two platforms, that is the Prep Ladder and Unacademy, and these are the rates, and you can see now the rates has been quite low. So for 1 year it's the 45,000 rate is just 30,000. So the discount is more than, so here the discount is more than 10%, and by using my code also you get more than 10% discount. So just go take the subscription, use my code NAT10 to get an additional 10% discount. So altogether you are getting more than of 10%. I think nearly it is 15% discount or more than that. So just grab this opportunity because this is limited time offer. So first 50 students, first 500 students. Raja Ram, good evening Raja Ram. So first 500 students will definitely get this limited time offer where you are getting more than 15%. So it's approximately more than 15% discount is there. Generally you get a discount of 10%. So 12 months, 18 months, 4 years, 3 years discounted rate. So 75% discounted rate is just at 60,000 if you go for 4 year subscription. So you can just compare it. So I am just giving you this slide where you can see the rates, and it is quite low. Just grab it because more than 10% discount. Use my code NAT10 to get additional discount, and first 500 students will get more than 10% of discount. So just grab it my dear students. Yeah, Ranbir Patel, good evening dear. So my dear students, I would also like to inform you about the upgraded highly yield QBank of the Unacademy platform. So these QBanks has been made by the top educators of Unacademy platform. More than 25,000 high yield clinical MCQs based on latest exam pattern, includes a detailed explanation for each and every MCQs. Use the code NAT10 and avail the opportunity of getting more than 10% discount. Now, boost your preparation by taking 2 years of subscription and getting, good evening Parveen Sinha, getting 4 years of subscription absolutely free. Take 12 months of subscription and get 2 months of subscription absolutely free. So these are how you will have the opportunity of getting further discount and further subscription discount month. So just grab this opportunity, use my code NAT10. So what are the benefits of 1 month package? There is also 1 month package, but it will be useful only for the students, those who have done their entire course at least 2 times. So ultra fast high revision batches, emergency room MCQ batches, NEET PG test analysis batch, last 3 year, previous year MCQs, COVID test and grand test series. Okay. Neha Dikshit, good evening. Rishabh Gupta, good evening dear. So just grab this opportunity by using the code NAT10. Now target next 2022 batch and the FMG batch 2021. All these batches opportunities can be assessed by you, and join this batches, use my code NAT10 and get 10% discount. So MBBS 3rd year professional batch. So I would also like to give you the information, dear students. I am starting anatomy from 14th September, that is tomorrow. So from tomorrow I am starting anatomy series on the Plus platform of Unacademy. So those who are interested can join me. They can use the code ANAT10 and get an opportunity of 10% discount. Also, clinical examination procedure batches is going on. This batch is starting from 15th September. So so many batches are simultaneously running on the platform. So those who want to take the subscription, grab the opportunity, because the discounted rate is still there and it is more than 10%. I think it is approximately 15 to 18%. So just grab this opportunity, use the code ANAT10. Now my dear students, NEET PG subscription. So NEET PG subscription is compared here in this slide. As you can see here, the comparison is done in the Iconic and the Plus, as you can see, for the NEET PG subscription, and you can compare 4 years, 3 years, 2 years with that of both the Plus and Iconic. And if you are the students of just of first and second year, go for 4 or 3 years of subscription, or if you are students of final or for internship, then you can take 1 year of subscription. Use my code ANAT10 to get additional discounts. So now let's start with the topic, because many students has already joined, and let's start with the topic, parasympathetic ganglion of head and neck. So this is a very important topic, my dear students and aspirants. Myself, Dr. Monalisa, has done my MD Anatomy from Armed Force Medical College, Pune, and my code is ANAT10, which can be used by you if you want to take the subscription. So let's start with the parasympathetic ganglion. So when I am talking about parasympathetic ganglion, the important parasympathetic ganglion which should be studied by you and it should not be left out is that ciliary ganglions, Pterygopalatine ganglion, Otic ganglion and submandibular ganglion. So altogether 4 parasympathetic ganglion of head and neck region. Ciliary ganglion, as you can see, it is supplying the eye region, eyeball. Also Pterygopalatine ganglion, which is supplying the palate, nose and lacrimal gland. Otic ganglion for parotid gland, and submandibular ganglion for sublingual and submandibular gland. So I would like to give you the detail of each of the ganglia: otic ganglion, Pterygopalatine ganglion, ciliary ganglion and submandibular ganglion. Then I will also give the details of how the nerves are traversing, which type of fibers are passing, which fibers are relaying, which fibers are not relaying. So let's start with the first ganglion, that is otic ganglion. The first ganglion which I want to explain is the otic ganglion. Otic ganglion is a small parasympathetic ganglion which is connected to the mandibular division of trigeminal nerve, and actually it's a relay station for carrying secretomotor fibers. For anyone remembers, it carries secretomotor fibers for which gland? Anyone? Otic ganglion. Otic ganglion is carrying secretomotor fibers for which gland? So if I talk about the introduction point of view for the otic ganglion, it should be clear to you that otic ganglion is a small parasympathetic ganglion. All of you can write along with me so that you can complete your notes and you can just revise it before your examination. It's a small parasympathetic ganglion. It is connected to mandibular division of trigeminal nerve. So I will come up with the topographical and functional relation. Many of the students always have a doubt, ma'am, what do you mean by topographical and what do you mean by functional relation? So I would like to give that additional information also. Don't worry, topographically means structurally वो गैंग्लियन किस नर्व से रिलेटेड है. सो स्ट्रक्चरल और टोपोग्राफिक रिलेशन ऑफ ईच गैंग्लियन मस्ट बी नोन along with the functional aspect. Okay, so parotid, yes, Arshan is absolutely correct. It's a small parasympathetic ganglion and it carries, so absolutely great Arshan. So it carries secretomotor fibers to the parotid gland. It carries secretomotor fibers to parotid gland. The next important point is we have to know topographic and the functional correlation. So if we talk about otic ganglion, write down topographically it is related to which nerve? The answer is mandibular nerve. Mandibular nerve is a division of trigeminal nerve. The next is functional. When I am talking about the functional relation, functionally it is related to glossopharyngeal nerve, 9th cranial nerve, glossopharyngeal nerve. And it's a very small, what I told you, otic ganglion is a very small ganglion and approximately size is of pinhead. It is having a pinhead size corresponding to 2 to 3 mm. And anybody want to tell me where is it located? It is a very important structure located in one of the important region of head and neck area. The location is, it is lying in the infratemporal fossa below the level of foramen ovale. So write down location. Location is also important for you to know otic ganglion. Where it is located? Infratemporal fossa. It is located in infratemporal fossa. And exact location is below the level of foramen ovale. So it is lying below the level of foramen ovale. So this is about location. So otic ganglion location, topographic and functional correlation has been done. Now I would like to give just a brief about its relation also. So my dear students, see here, this is a diagram where you can appreciate the location of otic ganglion. The ganglion which is shown in the green color is the otic ganglion, and you can see it is suspended by, it is just located very close to that of mandibular nerve, and the reason where it is located is below the zygomatic arch, below the zygomatic, this is the cheekbone, this is the zygomatic arch. So below it, this region is the infratemporal fossa. So it is located in infratemporal fossa. So here you can see here, this is the otic ganglion which is shown in the diagram. Okay, located in the infratemporal fossa. Located in infratemporal fossa. Now coming to the relation, so actually it is related on the lateral aspect, it will be related to mandibular nerve. Medially it is having tensor palatini muscle and to the posterior aspect. So here it is lying posteriorly to it lies the middle meningeal artery. So it is, as you can see in the diagram, it is quite correlated to mandibular nerve, and because of its structural relation to the mandibular nerve, it is having topographic relation to mandibular nerve. Middle meningeal artery, so here you can see here, this is the middle meningeal artery. Okay. This artery which you are seeing is the middle meningeal artery, and if this is the otic ganglion, middle meningeal artery is lying posterior to it. Middle meningeal artery is lying posterior to otic ganglion. Okay. Anterior to it. So can you see here the muscle which has been dissected out? So can you see here the muscle which has been dissected out is medial pterygoid muscle, and medial pterygoid muscle is lying on the anterior relation to otic ganglion. So we are quite clear with these things in the diagram. So let me write it. So location of otic ganglion is absolutely clear to you. You are knowing that it is related in infratemporal fossa. Below foramen ovale, we have done this, below foramen ovale. Now moving on to the next is the relation, and we have just discussed about the relation also. Let me just write in brief about the relation so that you can revise it afterwards. So yes, once more let's talk about the relation. So relation, which nerve is lying on lateral aspect to otic ganglion? The nerve which is residing lateral to otic ganglion is mandibular nerve. Medial, which structure is lying medial to otic ganglion? Tensor palatini muscle. Tensor palatini muscle. Posterior, which structure is lying posterior? We have seen in the diagram also, one of the important arteries lying posterior to it. MMA, what is it? Middle meningeal artery. And which structure lying anterior, which has been slightly dissected out. So when you will dissect out the medial pterygoid muscle, then only you will be able to see the otic ganglion when you go for dissection. So anteriorly it is related to medial pterygoid muscle. Medial pterygoid muscle. Got it, dear? Okay. Now I would like to talk about the roots and the connection of otic ganglion. So, my dear students, if we talk about the roots of the otic ganglion, there is three important connection or roots of otic ganglion which needs to be studied in detail. One is the parasympathetic fibers, other is the sympathetic, and the other one is the sensory. So, we have to know each in detail. So, let's start with that. So, first thing is to know about its connection. So, otic ganglion and its connection. So, what I told you, if we talk about the otic ganglion and its connection, the important connections of otic ganglion which has been quite correlated here and has been shown to you also in the diagram. Okay, is it visible? Yeah. So, you can see here green color has been used for parasympathetic fibers, and parasympathetic fibers, preganglionic fibers are arising from, inferior salivary nucleus. Inferior salivary nucleus, and from here the fibers are traversing along with tympanic branch, glossopharyngeal nerve, tympanic branch, forming tympanic plexus in the middle ear cavity via lesser petrosal nerve. Now the fibers are relaying. So, you can see here the parasympathetic fibers relay in the otic ganglion, and from here postganglionic fibers arises, and via auriculotemporal nerve it is giving secretomotor supply to parotid gland. It is giving secretomotor supply to parotid gland. Don't worry students, I have also prepared a flow chart for you which will be very easy, and if in the examination it is asked, you can just draw that flow chart. This is, and also what I have seen in the previous year trends of MCQs being asked, the parasympathetic ganglion of head and neck is very, very important. You can't leave this topic. Now, coming to the sympathetic one, which is arising from T1 segment, fibers are relaying in the superior cervical ganglion, then forming plexus here, as you can see here. About the middle meningeal artery is covered by plexus of nerve, and the fibers of sympathetic fibers, as you can see, is not relaying in the otic ganglion and supplying parotid gland via auriculotemporal nerve. The sensory innervation, which is shown in yellow color, is also via auriculotemporal nerve. Okay, so now let me show you this flow chart which will be easy for you to understand. Okay, so yes, now let's talk about the motor or parasympathetic. So, what I told you, the fibers are arising from inferior salivary nucleus in the lower pons. So, the first step is the fibers are arising. So, preganglionic fibers are arising from. So, preganglionic fibers are arising from inferior salivary nucleus, preganglionic fibers via glossopharyngeal nerve. Now, tympanic branch of glossopharyngeal nerve is forming tympanic plexus via here lesser petrosal nerve, and now the fibers will reach otic ganglion. Okay, the fibers, parasympathetic fibers are reaching the otic ganglion, which forms a relay station, and from here postganglionic fibers are arising via auriculotemporal nerve. It is supplying which gland? It is supplying parotid gland. Actually, parasympathetic innervation is responsible for secretomotor fibers or watery secretion from that of the parotid gland. Now, what about sympathetic root? So, we have done with the parasympathetic. We have seen the whole of this. We have shown. We have just. If you want to brief it once more, should I brief it or is it okay? Let me know. Yeah. Yeah. So, preganglionic parasympathetic fibers arising from inferior salivary nucleus, which is lying in the pons. From here, the fibers passes successively via glossopharyngeal nerve, the tympanic branch forming tympanic plexus, and via lesser petrosal nerve, relay in otic ganglion, postganglionic fibers arises, and via auriculotemporal nerve give innervation to parotid gland. So, what is next? Let's move on to the sympathetic innervation supply. So, please write in just brief about sympathetic innervation. So, sympathetic innervation of the of the otic ganglion, the fibers which is passing, arises from. So, it is actually arising from, sympathetic innervation arises from the plexus which is formed around which artery? Middle meningeal artery. So, first thing is that, first thing write preganglionic, first thing write on preganglionic sympathetic fibers arises from, preganglionic sympathetic fibers arises from T1 and T2. It arises from T1 and T2 spinal segments. So thereafter they are traversing through cervical sympathetic. They traverse to cervical sympathetic ganglion at the level of inferior ganglion of cervical sympathetic chain. And what happens here, the fibers will relay. So actually they ascend, so they will traverse, and actually the fibers will relay, the fibers, cervical sympathetic chain, they will reach, and actually the fibers will relay at the level of superior cervical sympathetic ganglion, superior cervical sympathetic ganglion. So traverses through inferior ganglion, but the fibers relay in the superior cervical sympathetic ganglion, and from here the fibers will form plexus around middle meningeal artery, and these fibers will pass through the ganglion, but it will not relay there, and via auriculotemporal nerve, it will innervate parotid gland, PG, parotid gland, PG for parotid gland. So is it okay? So we have done with the sympathetic innervation. So the fibers are relaying where? So it is important for you to know the fibers are relaying in superior cervical sympathetic ganglion. Fibers do not relay in the otic ganglion, and via auriculotemporal nerve supplies the parotid gland. Now the third component is sensory root. So when we are talking about sensory root, my dear students, when we are talking about sensory root, the sensory root also arises from auriculotemporal nerve and supplies the parotid gland. So yes, done. Few books have also written about somatic, that is nerve to medial pterygoid will also pass without forming any kinds of relay, but will supply tensor palatini, tensor tympani muscle and nerve to medial pterygoid. Now coming to the branches. So if we talk about the branches, actually the branches which is post-ganglionic branches which arises here are sympathetic, sensory, and via auriculotemporal nerve they will supply the parotid gland. So the branches are traversing and giving innervation to parotid gland. So all these branches will traverse along auriculotemporal nerve and will supply parotid gland. Now one more, so moving on to pterygopalatine ganglion, one more thing is clinically important. So I just want to mention here, clinical importance is that actually in human beings the otic ganglion is connected to coda tympanic nerve. So in human beings what you will see that otic ganglion is also forming connection to that of coda tympanic nerve. So actually this is an alternate route for the taste sensation to be traversed by anterior 2/3 of the tongue. Also otic ganglion is forming connection to nerve of pterygoid canal. Yes, absolutely okay. Let's move on to the next one, pterygopalatine ganglion. The next ganglion is pterygopalatine ganglion. Actually of all the ganglions, it's the location of pterygopalatine ganglion is the pterygopalatine fossa, and it is considered to be the largest parasympathetic ganglion of head and neck region, and it is also called as ganglion of hay fever, and it is carrying secretomotor fibers to that of to that of lacrimal gland, mucus gland of nose, palates, pharynx and paranasal sinuses. To parotid gland, secretomotor fibers is traversing along otic ganglion to the pharynx, to the nasal cavity, to the paranasal sinuses, to the lacrimal gland. It is via pterygopalatine ganglion. So write down this point, pterygopalatine ganglion. Just few points about introduction. It's also called as ganglion of hay fever. It is the largest parasympathetic ganglion. It's the largest parasympathetic ganglion of head and neck region. is the largest parasympathetic ganglion of head and neck region, and it carries secretomotor fibers to lacrimal gland. It carries secretomotor fibers to lacrimal gland, pharynx, paranasal sinuses, palate, nose, mucous gland of the nose, paranasal sinus, pharynx and palate. Now, pterygopalatine ganglion, if I talk about its location, where is it located? So, it is located where? If I talk about its location, it is located in pterygopalatine fossa and it is connected. So, one of the important content of pterygopalatine fossa. And the next important point is, before starting any of the parasympathetic ganglion, you have to know, this has been asked several times in the MCQ session also, you have to know that its topographic relation and its functional relation. Anyone wants to comment? Pterygopalatine ganglion is topographically, means structurally it is related to which nerve, and functionally it is related to which nerve? Anyone wants to add on? Functionally, pterygopalatine ganglion is related to which nerve? Any idea? It's related to facial nerve. And what is the relation via? The nerve through which it is related is called as greater petrosal nerve. Which is the nerve? It is called as greater petrosal nerve. Now, this is about functional relation, and moving on to the structural, that means topographic relation. Topographically, it is related to which nerve? The answer is maxillary nerve. It is related to maxillary nerve, that is maxillary division of trigeminal nerve. Done? Now, coming to the relations. So, location, we have already seen the location, it is in pterygopalatine fossa, it is in pterygopalatine fossa, and the next important point is that we have to know its relation also. So, let me slightly highlight this diagram. Okay. Okay, so here the other name of pterygopalatine ganglion is also called as, it's also called as sphenopalatine ganglion. So, here let me slightly highlight it. So, this is the, so let me use pink color for that, you can understand. Yeah, so this is the sphenopalatine ganglion, which is also called as pterygopalatine ganglion. So, you can see the two nerve roots which is holding this, okay, there are the two roots nerves which is lying above and holding it. This is the branch from, this is the maxillary nerve. So, it is the two nerve roots which is holding this ganglion is the, from it, what, from where it is arising? It is arising from maxillary nerve. So, the maxillary nerve is lying above. So, quite clear in this diagram is the maxillary nerve. Two roots is holding this ganglion, as you can see here. Can you see here? This nerve which you are seeing here, this nerve which is holding it, this is the maxillary nerve. This is MAX. MAX for maxillary nerve, which is holding it is the pterygopalatine ganglion. So, this is quite clear. So, and other than that, behind there will be pterygoid canal. Medially there will be a foramen, that is called as sphenopalatine foramen, and in front there is perpendicular plate of palatine bone which has to be removed, so that you can clearly see this relation and the diagram. So, here you can clearly see the maxillary nerve which is holding it. So, clearly you can visualize here, this is the maxillary nerve which is holding this pterygopalatine or sphenopalatine ganglion. So, write down relations. Behind, which structure is residing behind? Pterygoid canal. Yes, all of the students, are you understanding? Is it okay? Are you understanding? Behind lies the pterygoid canal, medially lies the sphenopalatine foramen, sphenopalatine foramen in front. What lies in front? Perpendicular plate of palatine bone. What lies above? Which structure is holding this above? We have seen in the diagram, maxillary nerve. Now, next important point which we have to know is the root. Okay. So, like when we have discussed the otic ganglion, there also we have seen that sensory root, motor root and motor, parasympathetic and the sympathetic. So, all these three roots we will discuss here. So, firstly let me discuss about, so let me show you this diagram and then I will show you the flow chart for it. So, here we can see actually when we talk about the motor root of the pterygopalatine ganglion or parasympathetic root, it is derived from. So, firstly there is lacrymatory nucleus and superior salivatory nucleus, which you can see lacrymatory nucleus, superior salivatory nucleus in the pons, which is the from where the preganglionic fibers arises. So, there is two pathway for the lacrimal and that of the innervation to that of other structures like nasal, palatine, pharyngeal branches. So, they are traverses. So, facial nerve, greater petrosal nerve forms joins with the deep petrosal nerve. So, how is the deep petrosal nerve formed? The deep petrosal nerve is formed by the plexus of nerves which is forming a loop around internal carotid artery. So, these two nerves join together to form the nerve of pterygoid canal, and here the fibers relay, and you can clearly see here in the diagram also that this is the maxillary nerve which is holding this pterygopalatine ganglion, and from here the postganglionic fibers arises and will supply many of the structures, okay, lacrimal gland or give orbital, nasal, palatine, pharyngeal band. So, we will discuss one by one each of this in detail. So, let us start with the motor and that of the parasympathetic root. Parasympathetic root. So, let us start with the motor and parasympathetic root. So, if we talk about palatine and nasal gland, I am not starting with the lacrimal one. So, if we are talking about if we are talking just about the parasympathetic root or motor root for the innervation of nose, okay, nasal glands and that of palates. Okay. See here. So, which is the ganglion? Superior sal. The preganglionic fibers will arise from superior salivatory nucleus. Where it is located? It is located in the lower part of the pons. From here, nervus intermedius. Nervus intermedius is actually the branch of the facial nerve itself, which is residing in between the motor and vestibulocochlear nerve, and through greater petrosal nerve it traverses, it is formed as Viaden nerve. So, how it's the nerve of pterygoid canal formed, we have just discussed. Nerve of pterygoid canal or the Viaden nerve is formed by, so please note down all of you, nerve of pterygoid canal or Viaden nerve or nerve of pterygoid canal is formed by joining two nerves. One is greater petrosal nerve which joins with the deep petrosal nerve. These two nerves join to form the Viaden nerve or nerve of pterygoid canal. Greater petrosal nerve, branch of the facial nerve, and the deep petrosal nerve is formed by sympathetic plexus. Okay, sympathetic plexus which is formed to be surrounding, sympathetic plexus which is surrounding internal carotid artery. Yeah, we have seen here also internal. Can you see here? Deep petrosal nerve is formed by the plexus surrounding internal carotid artery. So, yes, thereafter the fibers will relay in the pterygopalatine ganglion. Postganglionic fibers arises and via nasopalatine nerve, greater palatine nerve will innervate the nasal gland and palatal glands. Nasal glands and palate. So, this is the flow chart. So, all of you, the students, you can either click the snap or you can quickly write in your notebook the flow chart. If it comes for exam or for your quick revision, the flow chart is enough. So, this was the flow chart for the innervation of or showing the parasympathetic roots or fibers which is innervating the palatine gland and the nasal gland. So, lacrymatory gland ke liye one more flow chart I want to explain. So, this is another diagram where you can appreciate the innervation parasympathetic fibers route for lacrimal gland. So, here the Preganglionic fibers are arising from which nucleus? Lacrymatory nucleus lying very close to superior salivary nucleus. Preganglionic fibers arises, passes via nervous intermediaries, trunk of facial nerve and the greater petrosal nerve, and we know that the Pterygopalatine ganglion act as a relay station for the fibers passing for the lacrimal gland, then via maxillary division of trigeminal nerve, zygomatic branch, okay, zygomatic branch, then via zygomatico-temporal nerve. So, the relay happens in the PPG ganglion only, and from here the fibers, nerve fibers arising is the maxillary division of trigeminal nerve, zygomatic nerve, zygomatic temporal nerve forms a communicating branch with the lacrimal nerve, gives glandular branch, and ultimate destined point is reaching the lacrimal gland for the secretomotor fibers, or lacrymatory fluid is released via lacrimal gland through this route. This is the parasympathetic whole route for innervation of the lacrimal gland. So, whole flow chart is here. You can either click the photograph or you can quickly fast forward and read or write itself. This is the whole flow chart of parasympathetic innervation of lacrimal gland. Next is the sympathetic. So, we have done with the parasympathetic. In brief, I would like to tell you about the sympathetic and the sensory roots or the nerves which is roots which is traversing through Pterygopalatine ganglion. So, sympathetic root. So, right now, sympathetic root. Actually, it is derived from sympathetic plexus around internal carotid artery. So, it is derived from sympathetic plexus around internal carotid artery, then via nerve to pterygoid. So, this will form deep petrosal nerve, it will join with the greater petrosal nerve, then via nerve to pterygoid canal, then via nerve to pterygoid canal. Now, it contains what it contains. So, actually it contains postganglionic fibers. So, what is the relay station for sympathetic fibers is superior cervical sympathetic ganglion. So, it contains postganglionic fibers from superior cervical sympathetic ganglion. Superior cervical sympathetic ganglions. Now, then the fibers which is passing through exactly PPG, that is Pterygopalatine ganglion, which will pass without relay, means the fibers are not relaying here and will provide vasomotor supply to the mucous membrane of nose, palate, pharynx and paranasal sinus. So, without relaying and will innervate. So, will give vasomotor supply to which structure? It will give vasomotor supply to the mucous membrane of nose, paranasal sinuses, pharynx, palate. Now, if we talk about sensory, so sensory is directly derived from maxillary nerve, okay, and distributed to the branches of Pterygopalatine ganglion. So, done with this. Now, branches and distribution. So, if we talk about the branches and distribution of the Pterygopalatine ganglion, so important branches are, it is giving lacrimal branch as you can see here, lacrimal branch for lacrimal gland, palatine branch, nasal branch, you can see here pharyngeal branch, orbital branch. These are important branches. Orbital branch. So, orbital branch will actually traverse to the orbit via inferior orbital fissure and will give secretomotor fibers to lacrimal gland. And if we talk about the nasal branches, it will pass through sphenopalatine foramen and will supply the nasal cavity. Pharyngeal branch will pass through palatovaginal canal and it will supply nasopharynx. Okay. So, in short, let me write it. So, branches and distribution. So, yes, everyone, are you understanding? Yashi Astana. Yeah, good evening Yashi. Good evening Yashi. Yeah. So, everyone let me know, are you understanding? So, branches and distribution. Okay. branches and distributions. The first is orbital branch. Orbital branch. So 2 to 3 orbital branches are given. 2 to 3 orbital branches are given. Actually 2 to 3 orbital branches are given, and this will traverse through the, it will traverse to the orbit via inferior orbital fissure, inferior orbital fissure, and will give secretomotor fibers to lacrimal gland, and also will be distributed to ethmoidal air sinuses. So this is about orbital branch. What are the other branches which has been given? Other than that, palatine branches has been given, and if we talk about the palatine branch, there is greater palatine, and these are passes through the greater palatine canal, and it will supply the inferior quadrant of lateral wall of the nose. It will pass through palatine canal and will innervate posterior-inferior quadrant of lateral wall of nose. Lateral wall of nose. Done? So yeah, moving to the other branches, it also gives nasal branches. So what about nasal branches? It is passing through which foramen? Sphenopalatine foramen. It passes through sphenopalatine foramen and will supply nasal cavity. What about the next is the pharyngeal branch. If we talk about pharyngeal branch, it traverses through palatovaginal canal. And will reach and innervate the nasopharynx. So yes, we have done with this. Palatine branch passes through palatine canal. Also there is one more, that is lesser palatine nerve, passes through lesser palatine canal and will innervate soft palate via lesser palatine nerves. So done with this. Now we have done with this. Now next ganglion is ciliary ganglion. The next ganglion is the ciliary ganglion. So yes everyone, have you understood the pterygopalatine ganglion and otic ganglion? Okay. So any doubt, let me know. So let's discuss ciliary ganglion. Actually it's a peripheral parasympathetic ganglion which is topographically or structurally related to nasociliary nerve, and we know that nasociliary nerve, any idea? Nasociliary nerve is a branch of which nerve? It is the branch of ophthalmic division of fifth cranial nerve. So ciliary ganglion, topographically or structurally. Okay, grade 3, topographically it is related to nasociliary nerve, and nasociliary nerve is a branch from ophthalmic division of trigeminal nerve. It's a branch from ophthalmic division of trigeminal nerve. Got it? Now coming to functional. Okay, functional. So functional, if we talk about the functional, it is related to which nerve? It is related to oculomotor nerve. Functionally, it is related to oculomotor nerve. Now coming to the location. So for location, I would like to show you this diagram in which very clearly you can see ciliary ganglion, and ciliary ganglion is a minute body, approximately the size is 2 mm in diameter. It is lying near the apex and of the orbit between the optic nerve and lateral rectus muscle. So the muscle which has been dissected out, if you will see here, this dissected out muscle which you are seeing here, so that you can get a proper view of this ciliary ganglion. What is this ganglion? This is the ciliary ganglion. So exactly it is located in between the lateral rectus muscle, which has been dissected out so that you can see the proper view of ciliary ganglion, and it is exactly located between near the apex. So here this is the apex, so location is near the apex, and it is lying between optic nerve and lateral rectus muscle. So my dear students, if you will see this thick nerve which you are seeing, so which nerve is this? This is the optic nerve which you are seeing. This is the optic nerve. So exact location is between optic nerve and lateral rectus muscle near the apex. So is the location of ciliary ganglion clear to you? It is exactly located near the apex of the orbit, and in between the optic nerve and the muscle which has been dissected out is the lateral rectus muscle. So write down location of ciliary. Is it clear everyone? Location of the ciliary ganglion. Location of the ciliary ganglion. Yeah. So all the muscles we can clearly see here. The muscle which is in oblique direction, this is superior oblique muscle. This is the LPS muscle. This is the superior rectus muscle. This part is MR, medial rectus muscle. This is inferior oblique, and this is inferior rectus muscle. So in this diagram we can clearly see all the extraocular muscles. We can see the location of ciliary ganglion also. So let's move up with the next. Location of ciliary ganglion. Location of ciliary ganglion. So it's a minute body. Approximate size is 2 mm in diameter. Lying near the apex of the orbit, lying or located near the apex of the orbit, lying near the apex of the orbit, exactly between, it is exactly located between optic nerve and lateral rectus muscle, and the lateral rectus muscle. So done. Now the next important point is the distribution of the roots. So we know that if we talk about roots of ciliary ganglion, it is 3. That is, we have to know about the motor or parasympathetic root, we have to know, or communication you can say, sympathetic and the sensory. So let's discuss one by one. Now firstly I would like to discuss about, so 3 roots are there. One by one we will discuss the parasympathetic, sympathetic and sensory. So for that, this diagram is very useful for you to understand. So I will come up with the flow chart also. Before that, what I want to explain here, so if we talk about its parasympathetic, okay, so if we talk about parasympathetic, so let's discuss the parasympathetic first. So if we talk about parasympathetic, it is actually derived from the nerve to inferior oblique. Can you see here? This is the parasympathetic, which is shown in red color. It is derived from nerve to inferior oblique muscle, which is consist of preganglionic parasympathetic fiber. And what is the nuclei of origin? So the nucleus of origin is Edinger-Westphal nucleus. This is the nucleus which is located in the midbrain, close to oculomotor nerve nucleus. So close to oculomotor nerve nucleus there lies Edinger-Westphal nucleus, from which the pre-ganglion parasympathetic root of fibers is derived via nerve to inferior oblique, and these fibers are relaying in the ciliary ganglion. Can you see here? The red color fibers are relaying. The red color fibers are relaying in the ciliary ganglion, which is clearly seen as shown in the red color, and it will supply the muscles constrictor pupillary and ciliaris muscle. So postganglionic fibers will arise, and via ciliary nerve it is giving innervation to that of ciliaris muscle and the constrictor pupillae. Now let's see in green color, there is the sympathetic innervation. Preganglionic fibers arises from the T1 spinal nerve roots. The fibers are relaying in the superior cervical ganglion, forming plexus around internal carotid artery. Then this nerve, as you can see in the red color, in the green color, sorry, which is forming plexus around this internal carotid artery, passes through the ganglion without relaying. These fibers are not relaying and will supply with structure It is supplying dilator pupillary muscle. And what is the sensory one? Sensory one is arising from nasociliary. So very clearly you can see this is the sensory root which is arising, and this is fibers are also not relaying here via the nasociliary nerve. So let's discuss in brief. So I have already included the flow chart here for the parasympathetic innervation. Preganglionic fibers arising from, so here clearly you can see the preganglionic fibers are arising from Edinger-Westphal nucleus of the midbrain, then passing via oculomotor nerve, the lower division of oculomotor nerve, nerve to inferior oblique. Exact nerve is the nerve to inferior oblique. Relay station is ciliary ganglion. Postganglionic fibers arise, and via short ciliary nerve it is supplying two important structures, sphincter pupillary and ciliaris muscle. So this is the whole flow chart of parasympathetic innervation passing, or parasympathetic roots passing through the ciliary ganglion. So thereafter let's move on to the sympathetic root. So when I am talking about sympathetic roots, the sympathetic root, as you can see, the fibers exactly arises from T1 segment. So it is derived from, so exactly it is consist of, so if we talk about exactly it is consist of postganglionic fibers arises from superior cervical sympathetic ganglion. Actually superior cervical sympathetic ganglion mein parasympathetic fibers are innervating. So and it's actually if you talk about its preganglion, that is from T1 segment it arises. So we are talking about postganglion, and this will not relay, these fibers are not relaying in ciliary ganglion, these fibers are not relaying in the ciliary ganglion, will pass directly and will pass there directly. They are derived from the plexus, they are actually derived from the plexus which is formed around which artery, plexus around internal carotid artery, and will supply through short ciliary nerve. It will supply with structure. So short ciliary nerve it is supplying with structure. It will supply dilator pupillary and the blood vessels of the eyeball. It will supply dilator pupillae muscle and also the blood vessels of eyeball. Done. Now coming to the sensory one. If we talk about sensory root is derived from which nerve? It is derived from nasociliary nerve. It is derived from nasociliary nerve. It is consist of sensory branches which will have a sensation of pain, touch, temperature, and which will innervate the eyeball, which will also pass through ciliary ganglion, but here the fibers are also not relaying and will supply without relay to the eyeball structures carrying nasociliary, via nasociliary nerve the pain, touch, temperature sensation is received. So this is about the sensory root. Now if we talk about the important branches, they are actually the branches which arises from ciliary ganglion is the short ciliary nerves which arises, short ciliary nerves, approximately 8 to 10 nerves are there, and this will consist of all the roots and they will supply the eyeball, and importantly we have seen the exact nerves which is innervating the target structure. Okay. Now next is the submandibular ganglia. One more clinical aspect which is related to here, actually when we want to go for go for cataract surgery, so we want to dilate the pupil. So in that case ciliary ganglion is blocked. So ciliary ganglion is blocked if we want to dilate the pupil, and then the cataract surgery is performed. So the last ganglion for this session is the submandibular ganglion. And one of the most important thing which has also been asked in the MCQ, what is the other name of submandibular ganglion? The answer is it is also called as Langelay's ganglion. It is also called as Langelay's ganglion. It is also called as Langelay's ganglion. And this submandibular ganglion is carrying parasympathetic, it's a parasympathetic ganglion which is acting a relay station for secretomotor fibers of submandibular ganglion and sublingual gland. Submandibular ganglion and that of sublingual gland. So thereafter, let's discuss submandibular ganglion location and where it is lying. So submandibular ganglion के location के बारे में बात करेंगे तो it's lying in the submandibular region only. Actually, it is the size of pinhead and it is lying on the outer aspect of hyoglossus muscle. I would like to show you a diagram for it also. Before that, it is also important for you to know structurally it is related to which nerve and functionally it is related to which nerve. So structurally, submandibular ganglion or langeales ganglion is related to structurally lingual nerve, and we know that lingual nerve is again the branch of mandibular division of trigeminal nerve. If I talk about functional aspect or functionally its relation of the submandibular ganglion, functionally it is related to facial nerve via coda tympanic branch, Now coming to location, so as I told you, if we talk about the location of submandibular gland, exactly it is located over, so you can clearly see it is lying over which muscle? Hyoglossus muscle. It is lying over the hyoglossus muscle and suspended by two roots of lingual nerve. So let me just highlight it. So my dear aspirants, you can clearly see this is the submandibular ganglion. And submandibular ganglion, as you can see clearly in this diagram, this is the ganglion which is suspended by two roots of lingual nerve and lying over this muscle. Which muscle is this? This is the hyoglossus muscle. So it is lying over hyoglossus muscle. So if you talk about the relation, above lies the lingual nerve. So yes, above which nerve lying here? Lingual nerve. On the above it is lying the lingual nerve. Medially which muscle on which it is residing? That is the that is the hyoglossus muscle, and medial so that would be medially hyoglossus muscle. Below is the deep part of the submandibular gland below, and laterally will be the superficial part of submandibular gland. So right about this location we already know it is lying over the submandibular region. It is lying in the submandibular triangle or region. And what about relation, which we have seen? So let me just write about relation. So above it is related to lingual nerve. Medially or lying over which muscle it was resting? It was resting over hyoglossus muscle. So it was resting over hyoglossus muscle. Below, what is the relation? Deep part of submandibular gland. Deep part of submandibular gland is lying below. And what about its lateral aspect? So laterally, which structure lies? Laterally, submandibular gland, superficial part lies. So this is about the relation of submandibular gland, and let me explain you the whole three roots, submandibular ganglion and its connection. So let me slightly highlight it. So here if we talk about its, let me talk about firstly about the parasympathetic. So the preganglionic fibers is arising from superior salivary nucleus, as you can see here. This is a superior salivary nucleus located in the pons. Then the nerve is traversing via facial nerve, coda tympanic branch, via lingual nerve, and this is the ganglion where the fibers are relaying here, submandibular ganglion, and via lingual nerve it is supplying the submandibular ganglion. It is carrying parasympathetic innervation secretomotor fibers for two glands, submandibular and that of sublingual. The origin of preganglionic sympathetic fibers is from T1 segments. Fibers are relaying in superior cervical sympathetic ganglion. Then it forms plexus over the facial artery without relaying, passes through submandibular ganglion and supplies submandibular and sublingual gland. Also the sensory innervation is via lingual nerve. So write on this. Motor innervation. Parasympathetic. When we are talking about parasympathetic root, it is derived from, in one line you can say it is derived from lingual nerve. In one line you can say that, but if you want further explanation, so you can write preganglionic fibers. Preganglionic fibers arises from superior salivary nucleus. It arises from superior salivary nucleus which resides in the pons, and from here the fibers will pass successively via facial nerve, coda tympanic nerve, lingual nerve, then the fibers relay in the ganglion and will supply, postganglionic fibers will supply the submandibular ganglion and that of sublingual gland. They are required for the secretomotor innervation. Sympathetic roots, here the preganglionic fibers will arise from T1 segment of spinal cord, T1 segment of cervical sympathetic chain. Fibers will relay in superior cervical ganglion, and from here the fibers will form plexus around facial artery, then without relaying pass through submandibular ganglion without relay, no relay is there, and will supply sympathetic innervation to submandibular gland and sublingual gland. So, they will supply mainly the blood vessels of submandibular and sublingual gland. Now, sensory root will also is given via diverges via lingual nerve. Now, if we talk about its branches, so my dear aspirants, the branches are 5 to 6 branches are given from the submandibular ganglion to submandibular gland and that of sublingual gland. So, yes, in brief we have discussed all the parasympathetic, all the parasympathetic ganglion of head and neck region. What is very important for you to know is to know in brief about the pathways. The flow chart has already been discussed. You have to know the structural, that is topographic and functional relation of each and every ganglion. So, that is very important for you to know. Now, before ending the session, my dear students, I would like to tell you about my free sessions. So, Wednesday is coming, my dear students, and that is 15th September. So, do join me 15th September, 2 sessions, one is the 6 p.m. and the other is 7 p.m. 7 p.m. is for joint session and 6 p.m. is the recall questions MCQs of NEET PG 2021. So, we will have a discussion of recall questions of NEET PG 2021 and joint session at 7 p.m. Use my code NAT10 if you are seeing the session for the first time, and use it as an unlock code, also as a referral code for taking the subscription. So, my dear students, let me slightly enlarge this. Why I am enlarging this and focusing it, it's a very important information. Those who are planning to take the subscription, just go for NEET PG iconic subscription, and the rates has been quite discounted rate. It is, the discount is more than 10%. Use my code NAT10. So, what you have to use? You have to use my code NAT10. So, you have to use my code NAT10, and for the first 500 so students who want to take the subscription, you will get a discounted rate of more than 10,000, more than 10%, that is approximately 15 to 18% discount. So, just go it and grab it. So, you can see here 45,000 rate is just 30,000 and a discount rate of more than 15% and another 10% discount by using my code NAT10. So, there is limited time offer for taking the plus subscription and iconic subscription. Just go and grab it. First 500 buyers will get this opportunity. Now, yes. So, after that I would also like to tell you and discuss that if you are going to take 2 years of subscription, 4 months of subscription is absolutely free. If you are going to take 12 months of subscription, 2 months of subscription is absolutely free. So, just go and grab it. Use my code NAT10 for 10% discount. For additional 10% discount after this this great opportunity, additional 10% discount will be taken by using my code NAT10. Any doubt, let me know, students. Is the concepts clear? So, let me know. And also I want to tell that from tomorrow I am starting, that is 14th, I am starting the 3rd year professional batch. What does this mean? Actually, I am starting the whole of anatomy. Those who want to take the subscription and join, they can join me 14 September, Tuesday is tomorrow date. I am starting with my session, so you can take the subscription, join me live for all complete 19 subject along with me. All the subjects will be completed. Also clinical examination procedure batch is there starting from 15th of September. So you can take the subscription, use my code NAT10 not only for taking the subscription and getting an additional 10% discount, but also as an unlock code if you are going to see the session for the first time. So yes, tomorrow also we will meet up with 6 p.m. session. I will take a session for your anatomy, general anatomy second session. So I am going with the important topics in a very sequential manner so that you can have the session. And also Wednesday, 2 sessions of special classes on 6 p.m. and 7 p.m. session on the platform of Unacademy. So just download the Unacademy app, use the code NAT10 and be present for my session 6 and 7 p.m. session. One is the joint and the other is recall question of anatomy, NEET PG 2021. All the best, keep studying. Thank you so much. Ma'am, please take sessions on preganglionic fibers. Okay, you want to know the concepts of preganglionic and postganglionic fibers of ANS. Okay, Shri, I got it. Means you want to know the, I got your points, Shri. You want to know the concept of autonomic nervous system, preganglionic and postganglionic fibers. Okay, so today was session of head and neck, series of parasympathetic ganglion. So, okay, sure, I will take up that topic also. Okay, sure. Thank you. All the best. Keep studying. Okay, sure. Thanks dear. So we will meet tomorrow exactly with 6 p.m. session of general anatomy part second. All the best. Thank you. Thank you students.